Good afternoon and welcome to the City of Toronto's COVID-19 media briefing. Up first, we have Mayor John Tory. Go ahead, Mayor.
Good afternoon. Our Team Toronto effort has now administered more than 2.2 million COVID-19 vaccine doses in our city, and as we announced yesterday, more than 70% of adults in our city have now received their first dose of vaccine. As I've said before, this is a milestone, but not one that causes us to slow down on our work at all. It just really reinvigorates us to get on with making sure the rest of the people get vaccinated, and I'm going to discuss a bit of that today. We're trying to find more and more ways in which we can get that first dose into people's arms and, of course, the equally important second dose into people's arms as well. We are also seeing improvement in the number of new infections that are being reported, and Dr. de Villa will comment on that later today. I just want to say thank you to everybody who is participating, because we wouldn't be able to put 2 million plus doses into people's arms if they weren't showing up to have it done. And I want to say thank you to people who are obviously following public health guidelines that are helping us to get the rate of infection down as well. Our work to get as many people vaccinated as possible is continuing. And the first ActiveTO citywide telephone town hall will be held tonight starting at 6 o'clock. The town hall is meant to give people as much information as possible about getting vaccinated. We know that the more information people have, the more likely they are to get vaccinated. And it's okay to have questions about the vaccines and about the process. We're having the town hall to address those questions, both for the people that are asking the questions and for all those who are listening and may not get a chance to ask a question, so that everybody has the information they need. The call out to encourage people to join the telephone town hall tonight has itself, just the call out inviting people to the town hall, has resulted in almost 4,900 people connecting directly to the provincial booking line to get vaccinated. And we've already received more than 4,000 texts on our vaccine text line. Anyone can access this text line, which has a wealth of information about vaccinations and the availability of vaccinations, and it has information as well about tonight's town hall. And you can do that by texting the word vaccine to 1-833-750-0888. Throughout the pandemic, from the very beginning, we have worked very hard to protect our most vulnerable residents, especially those experiencing homelessness. This year, Shelter, Support and Housing's total operating budget for homelessness and Housing First Solutions is $663.2 million, including COVID-19 response costs. This is almost double the amount spent in 2019 before the pandemic, which was $365.8 million. This has gone, this money, to dramatically expanding our shelter system so there is proper physical distancing and so there is safe indoor space for those who need it. Staff are also working nonstop to make sure there are proper infection control procedures in place throughout our shelter system to help keep people, both the staff and the residents, safe. This is also going towards making sure there are proper supports right in the shelter system to help people, including real supports for mental health and substance use issues, just to cite two examples. It is going towards building more supportive housing options so that people can move out of the shelter system. And it is going towards getting more people who are experiencing homelessness vaccinated. More than 7,500 COVID-19 vaccine doses have been administered to people experiencing homelessness and people who are precariously housed, as well as people working in the homelessness and housing sector through on-site clinics in shelters or mobile clinics in the community. This has very much been a team effort, and I want to say thank you to that team. It's been a group of Toronto paramedics supported by the Sunnybrook Centre for Pre-Hospital Medicine, Toronto Public Health, Toronto Fire Services. All of those people are working together to attend shelters, to attend drop-in centres and encampment sites to immunize people 7 days a week. And I want to thank them for their dedication to this very important initiative. These efforts have worked to help 1,600 people, including 200 people in the last month, who are staying in encampments to make the move to safe inside space, and more than 5,500 people who were staying in our shelter system. It has helped them to move into permanent housing. This is the kind of progress that we're making. You've heard me say here many times that encampments are not safe, they are not healthy, and they are not legal. Since July 2020, the city's Streets to Homes and partner agency staff have engaged more than 19,000 times, 19,000 direct encounters with people who are experiencing homelessness, living outside, including those staying in encampments, listening to them, understanding their needs on a daily basis with care and with compassion, and offering them safe inside space with supports as well as referrals to permanent housing. And you've heard me say, thousands have been helped as a result of those 19,000 visits, those 19,000 encounters. We will never stop working to help our homeless residents and give them safe housing options. Just this week, we opened a new shelter in Scarborough, and we are continuing to work with local communities to provide more supportive housing units. I've personally attended all of the community meetings meant to move our supportive housing initiative forward, and it is an extraordinary commitment that we are making to change the way in which we are supporting people experiencing homelessness so that they have an even broader range of acceptable options. The City Manager will be bringing a report to the City Council next week on the ongoing efforts to help our homeless population. I think it is important that all of these efforts, some of which I've tried to summarize today, to keep people safe, the efforts to keep people safe are reported on publicly and to the entire City Council. Every member of Council and the public should have a full understanding of this complex issue and the work that our dedicated and caring city staff and community partners are doing to keep some of our most vulnerable residents safe and healthy, and to keep our parks safe and open for all people. Our work to make sure that our city is safe and open for everyone is something we've worked to do throughout the pandemic with public health advice. And we know this is incredibly important at all times, and that includes, in particular, the summer. Starting this Saturday, 10 Toronto beaches will officially open for swimming. Lifeguards will be on duty at these beaches and will supervise swim areas from 10:30 a.m. to 7:30 in the evening. Throughout the COVID-19 pandemic, we have worked to keep our beaches open so that people have places to go and be outdoors safely. We have some of the best swimming beaches around. In fact, 8 of Toronto's 10 beaches have been awarded the International Blue Flag certification, meeting high standards for water quality, environmental management, education, safety, and other services that are set pursuant to an international standard. As part of this year's Supervised Beach program, the City is preparing to launch a comprehensive public education campaign about beach and water safety. The campaign will highlight the importance of swimming only in designated areas, supervising non-swimmers and children at all times, information about the flag system that indicates when conditions are and are not appropriate for swimming, and a reminder about safe beach practices, including staying hydrated, wearing sunscreen, and not using substances while swimming. Finally, each day park staff work hard, as they will continue to do, to groom the beaches and to empty the waste bins, and even more. We've increased litter collection at our beaches to deal with the increased demand and increased attendance at those beaches during the pandemic, but we need your help in keeping those beaches free of litter. Please do your part by making sure you keep the beaches clean by properly disposing of your own waste. You can't imagine going to somebody else's backyard and just throwing things down, and why would you go to our collective backyard, which includes the beaches and the parks, and throw things down on the ground or just leave them there when you're finished with a visit? We really want everyone to enjoy the beaches and the parks safely this summer, and I know that we can do it if we work together on the safety but also on the cleanliness of those particular properties. This weekend, we're expanding the ActiveTO road closures and introducing this innovative program to another part of the city. It's something that I've worked very hard to do with things like Nuit Blanche and ActiveTO, to take them to all parts of the city so that everybody has a chance to experience this closer to their own home. We're committed to giving people more places to be safely outside, because we still do have to pay attention, even with the improved numbers, to public health guidelines, to safe distances, and to the wearing of masks. I'm very pleased to announce that this Saturday, June the 5th, ActiveTO is coming to the Allen Road and will complement the other planned ActiveTO routes. This weekend is a very special anniversary. It's the 50th anniversary of the cancellation by Premier Bill Davis, then Premier Bill Davis, to cancel the Spadina Expressway, a planned expressway through the heart of the city, which was opposed by many. Premier Davis famously said at the time, and it's interesting to think about him saying this 50 years ago, he famously said, and I quote, "If we are building a transportation system to serve the automobile, the Spadina Expressway would be a good place to start. But if we're building a transportation system to serve people, the Spadina Expressway is a good place to stop," close quote. Thank you to local councillor Mike Cole for proposing this idea to have ActiveTO on the Allen, what remains of the Spadina Expressway, to celebrate the 50th anniversary of the cancellation of the Spadina Expressway. So this coming Saturday, the northbound lanes along Allen Road between Eglinton Avenue West and Lawrence Avenue will be closed to vehicles and open for bikes and for people to walk or to run or using a mobility device or just out pushing a stroller. Due to the Eglinton Crosstown construction, the best way and the only way to access the lanes of the Allen to use for ActiveTO purposes will be at the top end at Lawrence Avenue and Allen Road. I encourage those planning to use this space to leave their car at home and access the Allen Road by bike, by pedestrian means, or by riding public transit. The Lawrence West subway station is right steps away from the ramps that lead down to the road that you can have some fun on this weekend. Arrangements have been made this Saturday to have bike share stations positioned within the Allen Road ActiveTO stretch for people who don't have a bike but who would like to experience the Allen Road on a bike. We will also have ActiveTO closures on Lakeshore East in High Park, along with the new Bayview multi-use trail available every day for people biking, walking, or running, or any other use they've been making of the ActiveTO spaces. Now it's time for Dr. de Villa to give her update on youth vaccination and generally on the health numbers. I just want to say that before she reports how incredibly impressed and gratified that I am by the extraordinary take-up that we've seen among young people in this city getting vaccinated. I was out last weekend to clinics where I saw all kinds of young people there on their own, which is terrific, young people who were there with their families, and I'm not sure who was taking who to get vaccinated, but it was all good because it was people of all ages there to get vaccinated. The kids are all right. Thousands of young people have stepped forward to get vaccinated, teens, people in their 20s. We're fast approaching the milestone of 80% vaccinated when it comes to the age group between 20 and 24, one of the best rates among all age groups in the entire city. This is great news. It's going to help to protect everyone. I hope people see it as an example, and I hope that this kind of trend carries on. And on that note, I'll ask Dr. de Villa to provide her remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 328 new cases of COVID-19. 774 people are in the hospital, and 221 people are in the ICU. I'm saddened to report 14 deaths today. To illustrate how far we've come in a month, I want to revisit briefly the figures I reported on Monday, May the 3rd. The average then was 1,037 new COVID-19 cases per day. 1,142 people were in the hospital and 272 were in the ICU. The dramatic change between then and now speaks for itself. Cases have declined significantly, and hospitalizations, while improving, are doing so more modestly, as is expected. The changing numbers reflect people taking to heart the stay-at-home order, the steps for self-protection, and the success of the vaccination campaign. As the Mayor just stated, already we've seen significant vaccination uptake for people ages 12 to 17. In Toronto, close to 75,000 in that age group have already received a first dose of vaccine. That's 46% of this group. A youth vaccination strategy is being co-led by Toronto Public Health and Sick Kids Hospital. Youth initiatives to support vaccination have so far included city-run immunization clinics, hospital clinics, school pop-up clinics, and mobile clinics led by hospitals, Ontario health teams, and community partners. As we move through June, you will see a focused effort to provide vaccination opportunities for children and young people between the ages of 12 and 17. Outreach strategies will put an emphasis on youth in priority postal codes and those who need additional support in accessing vaccines. Toronto Public Health and Sick Kids are working together to create communications for youth, their families, and caregivers to address common questions and misconceptions about vaccines and to support informed vaccination consent. We have significant capacity to boost youth vaccination numbers, to provide protection to them, their families, and to position everyone for a return to school in September. It is generally found that if a young person does get COVID-19, the course of their illness is mild. But we never want to take COVID-19 for granted, and we never want to take risks that we don't have to. Once COVID is in a home, it can easily infect everyone who lives there. We want to deny COVID-19 the chance to spread whenever we can. The Team Toronto Sprint strategy efforts, which include youth vaccination, is also ongoing. With increased coverage across the city, the next phase of the strategy will leverage data insights to focus vaccination efforts on neighborhoods and buildings with low uptake. One of the things we're keeping an eye on is the B.1.617 variant, or Delta variant, which is rapidly spreading in the United Kingdom in particular. There are 68 confirmed cases of this variant in Toronto. Like any virus, it spreads amongst the unprotected, but this variant is showing some capability for infecting even those who are fully vaccinated, albeit generally with a milder illness. The main message for us to draw from this is this: get vaccinated, and remember that for now, it's still really important to be mindful of distance between yourself and others, to wear your mask when you can't keep 6 feet apart, to do what you can to establish good ventilation indoors, and to spend as much time as possible outside if in the company of individuals outside your household. There's also work to get done where first vaccine doses are concerned. I want to run you through the numbers to illustrate the gaps in certain age categories, because we need as many people as possible to get vaccinated against COVID-19. People age 60 and over are doing well, with one caveat. Their first dose vaccination rate is between 77 and 78% until you reach the threshold for 80 years of age and over. There's a bit of a lag, as that age group only has a little more than 73% with a first dose. That leaves 27% unvaccinated, and that's concerning and has been concerning me for a couple of weeks now. We do not want any unnecessary suffering from COVID now that we have these powerful protections against it, especially in those who are most vulnerable to COVID. If you have an 80-year-old in your life, find out if they're vaccinated. Find out what you can do to help them get vaccinated if they're not. Those 55 to 59 are in a similar state. Around 72% of them have received a first dose. In contrast, 20 to 24-year-olds are leading the way. 76% of them have rolled up their sleeves. 25 to 29-year-olds are a little behind at 69%. Where I see a concerning lag is in a broad band of ages from 30 to 54. First dose vaccination rates across these age groups range from 61 to 67%. That leaves at least a third of people between 30 and 54 without the protection of a vaccine. This age group does a lot of the heavy lifting in daily life, caring for children, caring for elders, and they are the bulk of the workforce. We need you in good health. So to anyone still thinking about it, now's the time to act. There are still vaccination appointments this week, and many more in the next couple of weeks. I would like to see Toronto as a leader in vaccine uptake in the country and around the world. It's good for everybody, and it's what will bring us back to a life more like we knew it prior to COVID-19. So please, book your appointment, and let's keep moving forward to where we want to be. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. With more than 2.2 million doses of COVID-19 vaccine administered thus far in Toronto, more than 70% of eligible adults over the age of 18 have received their first dose of vaccine. This is an important and impressive milestone that moves us closer to the resumption of a much more normal life in our city, which is why we continue this work 7 days per week. Thank you to everyone who has and continues to support this important effort, and to everyone who has made the effort to get their vaccine. Everyone who is 12 years of age or older is eligible to be vaccinated. Also, beginning Monday of this week, anyone 80 years of age or older is now eligible to receive their second dose of vaccine. Those residents 80 years of age and older who received their first dose of Pfizer vaccine in one of the 9 city-operated vaccine clinics now have the option of rescheduling their previously booked second dose appointment into an earlier available appointment if they so choose. Eligible residents who wish to take advantage of the accelerated second dose eligibility can do so by accessing the reschedule link that is included in your appointment confirmation email that you received when you made your original appointment booking. This link will take you into the provincial booking system, where you will be able to book an earlier available appointment of your choice. You can also reschedule your appointment by calling the provincial call centre at 1-833-943-3900. As of this morning, there were approximately 4,000 available appointments in city-operated vaccine clinics for the remainder of this week. Our clinics are nearly fully booked for the week of June 7, although there are still appointments available for the weeks of June 14, 21, and 28. Between today and July 4, based on current vaccine allocations, there are approximately 71,000 appointments available in city-operated vaccine clinics. I remind everyone that AstraZeneca vaccine is only available in pharmacies and primary care providers. If you are 80 years of age or older and received AstraZeneca as your first dose, please contact the pharmacy or primary care provider where you received your first dose in order to schedule your accelerated second dose. I continue to encourage everyone who is 12 years of age and older to book your appointment to receive your first dose of COVID-19 vaccine as very soon as you are able. Please go to VaccineTO.ca for vaccine opportunities that may exist in Team Toronto partner clinics. And for those active on social media, I continue to encourage you to follow Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. We are experiencing an increasing number of no-shows in our city-operated vaccine clinics. Over the course of last week's operations in city-operated clinics, the percentage of people who did not arrive for their scheduled appointment ranged from 1.8% to as high as 4.2%. Our weekly no-show average increased to 3% last week. Our team is continuing to monitor this situation closely, and we are continuing to work with the province to ensure that the provincial booking system is as robust as possible in a collective effort to prevent no-shows and missed appointments. While no doses of vaccine were wasted as a result of no-shows, this does result in slower vaccine rollout across our city. Please ensure that you cancel your appointment via the provincial booking system or the provincial call centre in the event you will not be attending your scheduled appointment. Finally, I would like to raise two important public safety issues this afternoon. Over the course of the Victoria Day weekend, we experienced a number of issues relating to the discharge of fireworks. I remind everyone that fireworks can only be discharged without a permit from your own private property on Victoria Day and Canada Day. A permit is needed to discharge fireworks on any other day of the year. Fireworks may not be discharged in a city park, on a street, from a parking lot, or from other people's private property. Discharging or igniting fireworks in a city park or on a public beach is prohibited at all times. Fireworks have the potential to cause serious injury and must be supervised by a responsible adult at all times. Children and those under 18 years of age are not permitted to discharge fireworks. We are also experiencing a number of safety-related issues as a result of open-air burning. Under the Ontario Fire Code, open-air burning is not permitted anywhere in the City of Toronto without a permit authorized by Toronto Fire Services. This includes bonfires, campfires, backyard fire pits, and the use of chimeneas. Bonfires are not permitted in city parks, on beaches, nor in public spaces. Toronto Fire Services approves and issues permits for open-air burning in the City of Toronto on a case-by-case basis and under very limited and controlled situations. Open-air burning can cause significant fire hazards, can produce toxic fumes and chemicals, reduced visibility, and increased odors. Open-air burning, such as the recent bonfires along the waterfront in recent weeks, pose a risk to the parks and to the public. I encourage anyone who may have specific questions about open-air burning to contact our team at Toronto Fire Services, who will be happy to answer any questions you may have. As we head into the summer months, your attention to these important matters will help to ensure a safe and enjoyable summer for everyone. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you.
Thank you, Chief Pegg, Dr. de Villa, and Mayor Tory. We will now open up the floor to questions. As a reminder, it's one question, one follow-up. And when we do call your name, please unmute yourself. We also do have staff on the line if you do have any specific questions. First up, we have Brian from the Toronto Sun. Go ahead, Brian.
Good afternoon, everybody. Quick question. With the stay-at-home order having expired at midnight, I wanted to swing back to the topic of ActiveTO. We know there was a target date of June 14th coming out of Queen's Park, but how hopeful are you that the outdoor dining will actually be permitted by then, and what measures are in place to allow that to happen?
Just looking here. Hold on one sec, Brian. There we go. I'm very pleased to report that what we're doing at our end, so that when the order comes off, we will be in the position that we planned to be in when we began the installation, even though there was a stay-at-home order in effect at the time. As of today, in terms of curb lane cafes, there are 637 actually installed as of today. There are 57 on Destination Danforth that will be fully installed by Friday. There will be 22 more that will be installed in the beach tomorrow. And 49 non-BIA restaurants. So these are restaurants in areas of the city that don't have a business improvement area that are undergoing final review. And then 78 Window 3 restaurants registered to date, and the review and traffic plans have started. So that bottom line, we have 780 restaurants, 13 have a bit longer timeline, unrelated to transportation stuff, but related to other matters, so that we'll be ready, as we said we would. I think people going around the city can see a lot of the elements are installed, so that when the provincial order comes off, we're ready to open those patios and curb lane ActiveTO installations ASAP, so that people can enjoy them, but just as importantly, so that those restaurateurs and bars can get that revenue going.
Okay, oh, sorry. I apologize if I cut someone off there. The second question is for Dr. de Villa. The province does, let's say next week, decide to open outdoor dining. I apologize. Would you have any objections to allowing this to happen in Toronto?
So Brian, I would say this, my understanding is that the provincial government has their reopening plan, and I trust that they would follow the parameters articulated in that plan. And I think the important part here is to do any actions or to take any actions in respect of reopening in keeping with the best available data, what's actually happening out in the province, in the community, in regards to COVID-19. And to do so in a way that's informed with the best available evidence as well. So we're having constant conversations with our provincial partners in this regard, and we have every intention to continue productive conversations and to ensure that we're bringing forward data and evidence as decisions are considered and discussed.
For Brian and for your colleagues, I just had one more fact that was in this note. By June 7th, we'll be supporting nearly 1,000 restaurants with this program, which is 200 more than all the restaurants installed in the entirety of last summer. So again, I think the decision to move ahead, which we made a few weeks ago, and just have it all ready when the orders came off was a wise one, was the right one, and those curbside patios and others will be ready.
Thank you, Brian. Next up, we have Mark from City News. Go ahead.
Good afternoon. A question to Dr. de Villa first. The emphasis, and perhaps Mayor Tory, if you would, the emphasis today seems to be on trying to get more youth vaccinated at this point, although you addressed a number of issues in and around other demographics. I'm just curious, we're talking about first doses here and trying to bring up those numbers at the same time starting to roll out the second dose and concentrating on the 80-plus demographic. There are people that say 80-plus is too narrow, that we need to go lower, perhaps include more groups. Why is it that we're not including more people to get their second dose, especially when you're trying to fill some of those appointments that are vacant right now?
So Mark, I think the important point here is that I think as far as everyone is concerned, we want as many people as possible to get their first dose, and then as their turn comes up to get second doses as quickly as possible. I don't think there's any question whatsoever in that regard. Right now, the accelerated second doses, when we're looking at an age band perspective, the efforts are focused on those that are 80 plus, because we know that the most severe outcomes, the most serious of the outcomes associated with COVID-19 infection, unfortunately fall to the oldest in our community. Hence, the focus on the 80 pluses first when it comes to the age groupings. But, you know, let's be perfectly clear. We want as many people as possible, young and old and everyone in between, to get their first doses as quickly as possible, and then at the appropriate time, with the appropriate spacing between the doses, to get that second dose as well. I don't know whether the mayor has anything further to add to that.
Just to say that always operating within the constraints imposed upon us by supply, I think the city has done a remarkable job at dealing with all ends of the spectrum. We have the people that Dr. de Villa correctly described are perhaps facing the highest risk of serious illness, where we've got to push on to make sure that they get, in many cases, their second dose, and in some cases get their first dose. And we've had a remarkable record of success with the young people, and they've been, you know, people that have made that happen. Contrary to some comments people sometimes make about young people, they've been fantastic. But, you know, it's partially the result as well about having the right mix of clinics that are happening. Most of the mobile and pop-up clinics today across the city are around schools. That's not an accident. And it's not an accident that that's resulting in some very positive results for us. But I think that within the constraints of the supply that we have or don't have, you know, we are doing a remarkable job of trying to address, you know, what is millions of people. And we always knew it would be a big job, and I think we're doing it based on public health advice and succeeding, you know, as best one can at all ends of the spectrum.
I guess it's a bit of a precarious position right now. Well, that said, it has been throughout this entire thing. However, you're concentrating on getting more people their first dose. That is likely going to continue to slow based on the fact that there is a number of people that have had that already. But at the same time, you have to start ramping up the second dose campaign. So how do you go about doing that now and in the weeks to come to make sure that people are doing both?
So Mark, that's the subject of regular conversation at the health sector leadership table that is overseeing and really championing the vaccination campaign across the entire city. They are constantly looking at the data in respect of coverage, both on first and second dose and across the various age groups and geographies of the city, trying to make sure that as very best as possible and in keeping with the supply, that we're advancing and progressing in keeping with the science and the evidence around vaccination. So that's the constant conversation that's happening at that leadership table, and you can expect that it will be the case that we're going to keep having those conversations and adjusting actions in accordance with what we're seeing and in accordance with the evidence until the job is done.
Thank you, Mark. And next up, we have Jessica from CBC. Go ahead.
Good afternoon. We're hearing about a decline in demand for vaccine second doses, and I know that we did focus on, trying to get people that first dose, but in York Region, they're a little bit further along in their vaccination plan, and they're seeing for that 80 plus population group that demand for vaccines is going down. How concerning is this, given that you've already mentioned we're seeing a miss rate for these vaccine slots go up across the board?
So if I understand the question correctly, you're talking about vaccination opportunities for older individuals. Do I have that right?
Just they're seeing a decline in general. So they're starting to open up to 70 plus because they have all these appointments for 80 plus and they're going untaken right now. So how concerning is that, given that they're a little bit further along again in their vaccination plan, but that Toronto could be headed there, and as Chief Pegg and yourself mentioned, that the miss rate of vaccination appointments is rising as well.
Well, certainly I don't think we will be satisfied until we know that we have gotten vaccine to as many people as is humanly possible in the context of the city. And you'll have heard that we've adopted all kinds of strategies, and we're engaging in regular discussions at the vaccine leadership table with our vaccination partners, with community agencies, to understand, what barriers might exist for people in terms of accessing vaccine, and how we actually systematically eliminate those barriers and facilitate and support access for vaccination. We know that in a number of our communities there are clear barriers, but thankfully we have a number of really dedicated and incredibly knowledgeable community partners who are helping us, whether it's with the sprint strategy or whether it's around ensuring that we're getting to those who are homebound. We've had a homebound sprint strategy. We've got technologies being used, ActiveTO, so that we can reach as many people as possible with important messaging around vaccine. We're actually working with a variety of community agencies, serving different communities, whether they're certain seniors communities or certain ethno-racial groups, information being provided in several different languages. We're really trying to make sure that the information is getting out there and that we're providing as many opportunities and facilitating the ability of people to get access to vaccine. I think that's how we get around some of the challenges that have been encountered based on the evidence and based on the experiences of other jurisdictions, some of which are just in the GTHA.
Thank you. Many of those efforts that you mentioned are virtual or online based. How are we trying to target? You mentioned working with partner agencies, but how else are we trying to target working with battling vaccine hesitancy overall, especially with that seniors and 80 plus population?
So, I've spoken to some of the efforts that are in fact in person. So things like actually bringing vaccine to the homes of people who cannot leave their homes for medical reasons or otherwise. We're really focusing some efforts there. We've certainly tried to facilitate transportation with a number of options to help people get to a place where they can actually get vaccine. that over and above the virtual efforts to connect and provide people with information. And certainly one of the most successful strategies that we've deployed to date is actually bringing vaccines to those neighborhoods and communities, and in some cases to buildings. So I think one of the really incredible pieces of work that I'm quite proud of at the vaccine leadership table, health sector leadership table, I should say, is that they're looking at data and they have access to data, so they know where there are buildings where vaccine uptake is less than ideal. And they're actually bringing vaccine clinics to those buildings, particularly if they have a high proportion of seniors. These are the kinds of activities that I think really make a difference over and above the provision of information and connections with trusted community agencies and community members and leaders as well.
May I just add to that? I'm obviously not a doctor, but it is kind of a well-known trait of human nature that, and it's why they write on prescription bottles, take this prescription until it's finished. People, you know, having had one vaccination might think, well, I've had one vaccination. They read somewhere in the paper that provided a degree of protection, which it does after a time. But just like finishing the prescription, it's the second vaccination that has you fully vaccinated, and that is why we have embarked on all the efforts we've had. I think sometimes when we announce these things of these different programs that literally go and knock on doors or move vaccine clinics to buildings that house people that are more elderly, or that we have given thousands of people rides to get vaccinated. That's why we do these things, because human nature is such that, first of all, it's a little more difficult sometimes for people who are older to get to do this for a variety of reasons, but also just because human nature often says, you know, well, I've done it once and maybe that's good enough. And we're saying it isn't good enough, and that's why we're continuing and, in fact, expanding the programs, including, for example, my guess is if you looked at the demographics of the people who will listen to the town hall meeting tonight on telephone and listening to Dr. de Villa and Chief Pegg answer questions, it's probably going to skew to an older audience, but that's good because that may encourage some of them to get a first dose or a second dose. But we have every means we could possibly have in place that are meant to make it easier for that population to get vaccinated, and for everybody, for that matter. That's why the clinics are in the schools today, because we have a big push on to get younger people vaccinated. So we're on to the human nature, and we're dealing with it, I think, in a way that should make us proud, and that will be and is very effective in terms of the actual results it's going to produce. But we've said this is a work in progress.
Thank you, Jessica. Next up, we have David Ryder. Go ahead.
Hi there. My question also on vaccination, and that's with the first dose rollout with the city. We saw not great take up, I think, at the beginning when it was just book an appointment at a city clinic. The real boost came when a lot of the vaccination was moved out to communities with pop-ups and mobiles, and also key that the age eligibility was dropped so that you could get essential workers and others who are going into factories and not strictly going by age-based. It seems with the second dose, and I know that's set by the province, but we seem back to the old way. It's only 80 plus, and you go to the clinic. Are we going to see anytime soon more of an expansion with second dose like we saw with first dose?
So, David, I don't know that I would characterize it quite that way. I would say this, that we know that the risk of serious outcomes, the most severe outcomes associated with COVID-19, do unfortunately fall to the older members of our community. And I think that's the rationale behind accelerating the second doses for the oldest amongst us. But it is meant to rapidly increase or expand to cover the rest of the age groups. And part of that is around a question of supply, while at the same time making sure that first doses are available to those and are being taken up, most importantly, by those who have yet to take up that opportunity. That was the idea behind increasing the interval between that first and second dose in the first instance. So I think what you're seeing here is the deployment of the best available evidence and science to inform our vaccination efforts and to make sure that we're balancing out the needs appropriately. We absolutely want as many people as possible to get fully vaccinated as quickly as possible. And at this point in the campaign, that requires a combination of getting those who have yet to get their first dose to get that first dose, and of course to get second doses on board. as timing is appropriate and as supply allows, starting off first with those who are at highest risk and expanding as quickly as possible.
Thank you. My follow-up is that given NACI has said that it's safe for people to mix vaccines, to get AstraZeneca, for example, for first dose and Pfizer or Moderna for second, some people are saying the quickest way for Ontario and the city to rapidly boost second dose protection, especially with the variants rising, is to open up city clinics and the provincial booking system for people who got at a pharmacy to book. Is there any talk of that? Is that something we could see soon?
So, David, I believe that there is still some conversation that needs to happen at the provincial government level. You're quite right. The National Advisory Committee on Immunization issued its statement yesterday regarding the interchangeability of vaccines, and in particular indicated that those who'd received an AstraZeneca as their first dose could get as a second dose either the Pfizer or the Moderna vaccine, those being the two mRNA vaccines that are available currently in Canada. What has yet to be fully fleshed out is what the provincial approach to that will be. So I'm certainly looking forward to hearing what our provincial counterparts have in mind. And of course, you know, our key goal here, and I think that this would be true for our provincial partners as well, is to get as many people fully vaccinated as quickly as possible. So we're keen to hear what their position will be and how together throughout the province we're going to make this a reality.
Thanks, David. And next up, we have Mark Douglas. Go ahead, Mark.
Hi, thanks for taking the questions here. Dr. de Villa, on the topic of the schools in the province remaining closed, you were calling for schools to open. Do you believe the province has made a mistake here? Because we're seeing two very different philosophies, I believe, or two different outlooks from what they are mandating and what you were calling for.
You know, Mark, I would say this. The provincial government has made their decision in this regard. And so to my mind, I think at this point in time, the best thing for us to do collectively is to do everything in our power to make sure that that return to school in September is as strong and as seamless as is humanly possible. And so what that comes down to, in my opinion, is one, keeping transmission rates of COVID-19 as low as possible. And, you know, I won't repeat all the measures that we're so familiar with now about how that's done. You know, keeping distance, wearing your mask, increasing ventilation as much as possible. All the things I mentioned in my remarks and I've mentioned for many, many months now. And the second component to that, of course, is vaccine. Right? We need as many people as possible to get fully vaccinated as quickly as possible. I think if we do those things and we let our school or education partners do what they need to do to enhance the school environment to the greatest extent possible, this is what we can do collectively to ensure as strong and as seamless a return to school as is possible for the fall.
Thank you. And Dr. de Villa, a follow-up question then also about the school closures. With, you know, if the kids are going to have to miss out on these last few weeks of opportunity for socializing, for some, you know, just some regular recess playtime out in the schoolyard for the younger kids, in lieu of all that, for health, for physical health and mental health, what can kids do to stay happy and healthy without going back to school?
Well, you know, at this point in time, Mark, what I would say is this. Certainly, you know, we are at that time of year where we actually get nice weather. There's opportunity to enjoy the outdoors. And we know that being outdoors, even with other people, we'll still try to promote the distance as much as possible. But we know that activities that are done outdoors are certainly much, much safer relative to that which happens indoors. We would encourage people, to continue to maintain some distance as much as possible. And if distance can't be maintained, to wear a mask. But, you know, please do go outside, get that physical activity. It is good for physical health. It's good for mental health. And again, I just can't emphasize enough how important it is that we all do our part to keep COVID transmission low, to get our vaccine as soon as possible. It's these activities, it's those actions that will get us back to life more like we used to know it before there was a COVID-19.
Thanks, Mark. And last up, we have Denise from Canadian Press. Go ahead.
Hi, thank you. Question for Dr. de Villa. Now that the stay-at-home order is lifted, ban on evictions are also lifted. I'm wondering what your thoughts are on this. Last time the stay-at-home order was lifted, a legal group asked you to extend the eviction ban. That was back in December. I'm wondering if Toronto is thinking of doing this or just letting it.
You know, Denise, thank you for your question. I'll just remind people that when it comes to that which a local medical officer of health can do, you know, the Health Protection and Promotion Act allows for the exercise of certain powers in order to control, in very specific instances, communicable disease. So, you know, there really isn't a lot of opportunity, you know, in outside of those circumstances where there is a specific communicable disease and certain actions are needed to control that communicable disease in that environment. There's not a lot of latitude for medical officers of health. You know, I would say this, as we think about, you know, life more like it was before there was a COVID-19, you know, I will say it over and over again because I think the message bears repeating. The more we are able to bring transmission down through those actions that I've spoken of, you know, keeping your distance, wearing your mask, spending time outdoors if you're with other people, you know, all the things that actually reduce COVID-19 transmission. And the more we are able to take up vaccine and get fully vaccinated as quickly as possible, the sooner we will be able to resume you know, life more like it was before. And I think that that's where we need to focus our collective efforts as a city and as a large community.
Okay, thank you.
Follow up, Denise?
No follow-ups.
Okay. That's it for today, everybody. Thank you and have a great day.